The term agoraphobia is obtained from two words. Agora is a Greek word meaning marketplace, while phobia is an English word for fear. Basically, it stands for marketplace fear. Agoraphobia is a fear of situations from which a person sees that escape may be difficult, embarrassing, or inevitable. About 1 to 3% of the population suffer from agoraphobia. It's more common in women and symptoms may start in early adulthood. For one to receive a diagnosis of agoraphobia, they need to exhibit high levels of intense fear and anxiety. Also, they should experience at least 2 of the below listed situations for at least 6 months or longer. First, they should have fear of public transportation, fear of being in open spaces, fear of being in enclosed spaces, fear of being in a crowd or standing in line, or even fear of being outside home alone. These symptoms should be determined not to be caused by any other factors such as other mental health conditions. According to studies, agoraphobia may be caused by traumatic events, bereavement, substance abuse, family history, and genetics also play a role as it can be inherited. Panic attacks can also cause agoraphobia, and also hormonal imbalances in the brain. Let me give you a typical example of agoraphobia incidents, and we shall use this character called Mary. While Mary is at a concert with her friends, she feels intense fear and anxiety, after which she gets a panic attack. The incident is public and everyone notices and feels sorry for her. After this happens to her, every time she is in a crowded place, she is in constant fear of another attack. This feeling becomes overwhelming for her, and she quickly learns that avoiding the crowded places relieves the anxiety. She opts to get an online job and decides to spend most of her time at home where it's less crowded. She does most of her shopping and other necessities online. When she can't do something online, she gets someone to do it for her. Her family realizes she has become distant, and on visiting her, they realize she has not left the house for more than 8 months. They advise her to talk to a psychologist, after which she is diagnosed with agoraphobia. She begins her treatment, and is doing better now. Well, that's a typical example of agoraphobia. To improve agoraphobia symptoms, you should eat healthy, exercise, practice meditation or deep breathing, and avoid drugs such as alcohol.